everyone, and welcome to the NSAIDs Communication Bundle conference call hosted by Mark Easton. My name is Nikki and I'm your event manager. During the presentation, your lines will remain on listen only. If you require assistance at any time, please key *0 on your telephone and a coordinator will be happy to assist you. If you wish to ask a question on the WebEx, please click on the Q&A tab indicated by a question mark sign, type your question and click Send to All Panelists. I would like to advise all parties this conference is being recorded for replay purposes, and now I'd like to hand over to Mark. Go ahead, thank you.
Thank you, Nikki, and welcome to the NSAIDs Communication Bundle web event for dispensing GP practices. It's great to have you all on board today, and also if you're listening back via the web option at a later date, we just want to welcome you as well. Sorry you couldn't enjoy the live excitement, excuse me, but as I say, hope you'll enjoy it. Hope you'll find it useful and beneficial. As Nikki said, my name is Mark, and I'm presenting this on behalf of the Primary Care Improvement Portfolio of Healthcare Improvement Scotland. So what we'd like to do today is we would like to cover off some basics around the toolkit which has been sent out, but first of all, just to help you engage with what we're doing, as well as to give us some feedback, it would be great if we could ask you all just to pop something in the chat box around whether or not you've received your toolkit. If you haven't, that's absolutely fine. If you have, we would love to know. If you've got some other comment you'd like to put in about that, then that's fine as well. So yeah, if you want to pop something in saying what toolkit, that's absolutely great. Don't worry about it. So yeah, if you can pop some, we're getting some chat in there, so that's great. If you've received your toolkit, we hope you've had time to look through it. If not, don't worry, we will give you a bit more information today about how to use it. So the aims of today are primarily to give you some information about the NSAIDs Communication Care Bundle and how to use the toolkit in your practice to deliver the bundle. I should just say that what we want you to focus on is the bundle, not so much the toolkit, although the toolkit is full of goodies, and that's just great. You even get supplied with a pen, so no expense spared. So we want you to understand about the communication bundle, how it's going to work, and how it can support your QA development. We also want you to get a little bit of background to why we're going to be looking at NSAIDs and learn something about the data collection process and how data collection can support your improved, your quality improvement journey. We would also like to get some feedback from you on the toolkit, and that's very important for us. So if you want to share any feedback during the web event, that's great. If not, but you would like to give us some feedback later, then we will give you an email address that you can get in touch. And as we said, there will be some time for questions and discussion. If you want to pop questions into the question box as we go, that's great. But we will unmute the lines at the end of the presentation, just so that anyone who does have a question and wants to vocalise that, they can do that too. And we'll do our best to answer amongst us all. So that's the objectives. And we're going to start with just giving a little bit of background as to how we've come to this point. So the first starting point for this piece of work was way back in 2014 when Healthcare Improvement Scotland developed the Pharmacy and Primary Care Collaborative. And that was working across 4 boards. And within those 4 boards, there were 2 dispensing GP practices involved. Those were both in Highland, and they did some further development work on that as well. That work was then developed up to be rolled out at national level across all community pharmacies in Scotland. So 1,257, I think, at the point of distribution. Kits went out in May 2018, and then we've since developed a bespoke kit, especially for dispensing GPs, and that's the one that's been distributed to you all across the country. So we hope, if you've got your kit, we hope you like it, We hope it's going to be beneficial and useful to you. But what I would just say again is that the toolkit is exactly what it says on the box. It is a kit full of tools, so we need to know what to do with the tools and make sure that we're using the tools to deliver the right objectives, which, as I said before, is the care bundle itself. So just to bring us up to speed in terms of what a care bundle is, a care bundle, if you're not familiar with this concept, is more than a checklist. So a care bundle is very much about a collective document which covers off very simple parts of care, which, when they're delivered collectively and reliably, have been proven to improve the patient outcomes. So this is very much about doing this as a complete bundle, rather than saying, well, actually, we've got several things here that we're going to use, and, well, we'll maybe do one or two of them, but we don't like the third one, so we're not going to do that. So the data collection shows your 3 different data points, and then a 4th question, which is, have you delivered all 3 of the care bundle elements, and that gives you your collective score. So that's the principle behind the care bundle. And why are we doing this? Well, we're doing this because we've identified within Scotland that high-risk medicines are an issue. And it was great just within the WHO document, Medication Without Harm in 2017, to see that called out, where high-risk situations, and that's the phrase that we're tending to move towards now, was highlighted as a key area to protect patients from harm. Now, traditionally, we've thought of high-risk situations as high-risk medicines, and I will explain a little bit about that just in the next slide as to how we come by that definition. But as I say, we've been ahead of the game. We've already said that we started this work in 2014, but I should also really highlight that SPSP, the Scottish Patient Safety Programme, started in 2008 and is the first national safety programme in the world. So we're very much on the journey. We're not playing catch-up. We're not being told what to do by the WHO. We're very much involved in it, and this is a real commitment from Scottish Government to deliver the objectives of this document. So in terms of the high-risk medicines that we're looking at, or the high-risk situations, what we've found, and this is based on the most up-to-date data that we have, is that there are in the region of 61,000 non-elective hospital admissions per year in Scotland associated with 5 different groups of medicines. And the 5 groups are on your screen just now: NSAIDs, antiplatelets, anticoagulants, diuretics, and antihypertensives. And that's consistent as well with data that was identified south of the border by a multi-agency group. With the exception of antihypertensives, they chose not to look at those. The key criteria for these high-risk medicines are that the medicines are associated with preventable harm, and that the harm is associated with either omission, overuse, or incorrect use, and that the types of harm that are caused are either preventable or at least something that we're able to minimise. Now, you might ask, well, aren't we doing lots on those already? And why have we got NSAIDs within this picture? Because your typical idea of a high-risk medicine is probably something like warfarin or methotrexate or lithium. And absolutely, that's the case. Those certainly should be classed as high-risk medicines. What we would say, though, is that those drugs tend to be well managed. So we effectively manage the risk very effectively. So your methotrexate patient will have their folic acid prescribed. Your lithium patient will have the regular blood tests and the INR checks for your warfarin patients, if you still have some warfarin patients. Will all be in place. So those risks are very, very, very well managed. The difference between those type of high-risk medicines and the NSAIDs is very much about the breadth of use of NSAIDs. So whilst the harms are very broad, it's actually the volume of NSAIDs that creates the issue. So the NSAIDs are associated with more unscheduled hospital admissions than any other class of medicines, and that is partly due to the volume of NSAIDs purchased and also prescribed. And clearly the range of adverse events that we're looking at are quite broad as well. So we're looking at the gastrointestinal issues. We're also looking at intracranial bleeding, which is very significant, not in terms of numbers, but in terms of the outcomes. And also the cardiovascular and renal complications that are associated with NSAIDs. So we want to look at all those because those are all measures that we think we can improve the quality of our patients' lives with. And we have found that actually the patient knowledge in some cases can be very limited. The good news on this one is that over the last 3 years, the data that we have has shown 3 years to 2018 that nationally NSAID prescribing is falling. So there's clearly a recognition there that some NSAIDs are not being prescribed when perhaps they would have in the past, and that's probably for a variety of reasons. So there is some good news there around the NSAIDs. But what are we doing within our practices to try and improve things with the patients? Well, the bundle that we've developed, and as I say, this was piloted and then worked up and validated by the University of Strathclyde, has 3 questions. The 3 questions are, as per your screen: has a patient been informed to take their NSAID with or after food? Has the patient been informed to report any adverse drug reactions to the prescriber? And has the patient been informed to stop their NSAID medication during periods of dehydrating illness such as sickness and diarrhea? So clearly the first question is all about the gastric health. Second question being about that reporting mechanism, so that if someone does become unwell, then we've got some feedback back to the prescriber so that can be addressed. And the third question is addressing the issue of acute kidney injury, AKI, and trying to minimise the number of AKI admissions linked to NSAIDs. So this is the most important slide in the whole presentation. This is the slide that highlights exactly what we want to deliver to every person every time when we're supplying them with an NSAID. So every time that prescription goes out, this is the conversation that we want to have with the patient or with the representative who's collecting the medicine. And how can we do this? How can we deliver this effectively? Well, we're going to do this by a variety of means. The most important one in the whole of this is that we have a whole team approach. We found very much that by having whole team involvement, we had the best outcomes within community pharmacy, because this is very much about everyone being empowered to have the conversation with the patient. So this is not just about a doctor-patient conversation. Likewise, it's not just about that point of delivery. This is about everyone being involved in the team and being supportive and being creative as well. So within your toolkit, you'll have some stickers. Some people will be using those to highlight stock on their shelves. Other people will be using them to highlight an NSAID that's been bagged up and is ready to go to the patient. So be creative with those. Those are for you to use. There are no rules with them. You've also got some cards in the toolkit. Now, the cards are a great prompt when speaking to patients because they have the 3 questions on them as well as some additional information on the back. So these can be used as a good prompt. But the cards can also be given to the patients as that reminder, because we all know that patients don't remember everything they're told when they're in a consultation. So a little reminder for them to sit on their mantelpiece or on a kitchen table, whatever, is going to be useful to them. And the 5th point I want to make at this stage is about being conversational. Now, I would suggest that within dispensing practices, you probably know your patients better than in some other healthcare situations. So it's very, very easy for you to have the conversation with the patient rather than simply giving them a list of do's and don'ts. So instead of it being, okay, Mrs. McDonald, I've got 3 things to tell you. Will you just stand there and listen, please, because I'm going to tell you these, and here we go. It's going to be much more about that situation where you say, well, morning, Jean, how are you today? Are you getting on okay with your tablets? You're not getting any stomach trouble. Just remember, take them with food, and it's much more part of your conversation because these people are people that you know. So I'll really encourage that to happen. It may well be something that develops over time. So as you become more comfortable with the bundle, the conversational element becomes much, much easier. And that's certainly something that we found within the community pharmacy setting, that as we got more experience with it, then we did become more conversational. So we would like to know if you've applied for funding. Now, we haven't included within the presentation the link to the circular, but if anyone does need that link because they haven't applied for funding, although I believe the date is past, please get in touch with us and we can send you a link to that circular so you can get the funding. If you can give us some information in the chat box, that would be great about the support that you need for doing that. The circular was also the same circular that mentioned dispensing staff and FMD support. Now, about implementation of the bundle. One of the key elements of making this work is simplicity. So what we've done is we've provided you with a data collection chart. Now this is a white clean chart. It allows you to collect data on 10 conversations every week and then transfer that information onto some graphs. So your data collection is really simple. This is why you've been given a pen with no expense spared, so you can write on it and then wipe it clean. And it's a key part of the improvement process. So it's great to do the work, but it's also really important that to know that you're making improvements, you collect some data. So your data collection chart is there, and then once you've collected your data on your data collection chart, you can then transfer it onto your graphs. And you've got 4 graphs in your packs, one for each of the questions, and for the 3 questions, and then the 4th one, as I said, is about how you've implemented the bundle as a whole. So as you put in your data points on the chart each week, you very quickly build up a run chart. Now, a run chart is something, a principle you may or may not be familiar with, but essentially it's a graph of improvement against time, and that just allows you to see where you're doing well and where perhaps you're not doing so well. So it may be that you do very well on questions 1 and 2 initially, but you're having difficulty maybe having a conversation about dehydration and about sickness and diarrhea because it maybe doesn't fit so well with some of your consultations. So that might be an area that you want to review as a team after 2-3 weeks if that's a low point, and say, well, okay, so how can we make this better? What can we do to change it? And then you can simply write the details on your run chart as to what you've done, and that allows you to see how the changes that you make in your practice lead to improvements in the care that you're providing. Would now like just to check and see how we're doing with the your understanding of the toolkit and whether you think that's going to make care safer. So we've got a poll that we would like to run at this stage, and the poll is around the question, how useful do you think the toolkit will be to help you make NSAIDs safer? So Nikki, I believe, will be running the poll now, and the poll will be open for approximately a minute, and then we'll see some feedback on the screen. The great thing about these polls is there are never any wrong answers. that's quite nice. Okay, so thank you for engaging with that. So that's good. We've got a bit of a mix there, and that's really useful to us. So we've got some people who have engaged with it and some people who haven't had a chance, and that's good. So now that we've got your input on that question, we now want to just check and see how likely you feel you are to implement the bundle. So poll 2 is how likely is your practice to implement the bundle. So again, Nikki will open up the poll for us. We'll run that for a minute again, and your 5 options there are that you already have implemented it, or that they plan to do within the next 3 months, plan to do within the next 4 to 12 months, they may do, but not within the next 12 months, or you don't intend to implement it at all. So again, the poll is going to run for another 30 seconds or so. Great, okay, thank you all for your contribution there, and good. So we've got a range there, and that's really useful to us. That's really helpful, because we've always got the challenge of when we do work, that sometimes it's hard to know what's going to happen after you deliver. So yeah, thanks for everybody for their contribution there, and it is good to get everyone involved in the polls. Okay, so just to tie things up then, what you've been given is some tools, and these are tools that you can use. Tools themselves don't fix things, but we've given you a bundle which, as I said, has been validated, has some real value, and we've given you some tools to help support you in implementation of it. So what we're going to do next. First thing is to have a conversation within your teams as to how you're going to implement this within your practice. There will maybe some local practicalities you're going to have to work through in terms of what you're going to do with the bundle, who's going to do what you're going to do with cards and stickers. So have a chat about it, get on board. As I said, this is very much a team approach, but it may be that you want to identify an NSAID champion, so you may be one person in the practice who's going to lead on it, and that'd be great as well. And they can be a point of contact if they need any further support. And then have a go. Simply start using the toolkit resources, begin collecting your data, and keep talking about it, keep sharing your data. So put your run charts somewhere visible for the whole team to see, so that you can have those conversations, and you can keep going on the journey, and you can see the progress you're making. And please get in touch if you've got any questions. The contact email address is on the screen just now, or you can always find us on the IHub pages. You'll be able to search for us. So someone will get back to you from the team if you have any questions. And if you've got any good ideas, again, please share them. We would love to know what good things you're doing. So we don't want you just to come back to chat to us about problems. We really do want to hear about the good ideas. There is a dedicated web page for the dispensing GP practices, which is ihub.scot/NSAIDs GP. So again, if you would like to check the resources that are there, if you want any electronic resources, there are electronic data collection options there as well. So that may be something you want to use. So please do get in touch. As I say, if you've got good stories, improvement stories, we would love to hear them. Thank you very much for your time, and we're now going to open the lines up for any questions or feedback, and Nikki will do that now.
Thank you, Mark. If you wish to ask an audio question, please key *1 on your telephone. If you then decide to withdraw your question, simply key *2. All questions will be answered in the order received, and you will be advised when to ask your question. All other lines will remain on listen only. Just to remind you, if you wish to ask an audio question, please key *1 on your telephone. Alternatively, you may submit a question on the WebEx. To do this, please click on the Q&A tab indicated by a question mark sign, type your question and click Send to all panellists, or you can use the chat function. Again, send to all panellists. Thank you.
Okay, so there's been a little bit of chat there about further cards being printed, so I'll just pick up on that one while anyone else wants to pop anything in the chat box, because this was a constant question that came through from the community pharmacy teams. They had used their resources and they wanted more cards printed. Now, the cards essentially were printed as a one-off resource to help support teams. There is a print-ready function available on our website, so that can be used to if you want to print yourself. Equally, some health boards have chosen to print stock for use by everyone within the board. So it may be worth checking with your health board resource centre to see if they have some, because that certainly gives you the benefit of bulk buying, so your costs are reduced by that. So yeah, if you need more resources, and if you're really struggling, if you're really stuck, by all means get in touch via the email address, and if we can send you an additional resource, we'll try our very best. We don't have a lot, but if it's small amounts, we may just be able to help. So yeah, please do get in touch. The one thing we don't have any more of is any more of the pens, because they were far too expensive, weren't they, Kirsty? Mm-hmm. So, but yeah, we may have a small number of cards or stickers according to what you might need. So,
Nikki, can I ask, because I've been unmuted because I can't get my text box to work?
Yes, you have, Leslie.
Thank you very much. I don't know if anybody else is experiencing the same issues. Just following on from Mark, I don't know, I can't see if there's been any questions coming in, but I did notice from the poll that somebody had mentioned that they'd already started implementing the bundle, and I'd be really keen if they were happy to share on the call what their experience of that has been so far. I think it would be nice for everybody else that's maybe just thinking about starting it to hear how that's gone for them.
There's no questions on the audio at the moment, so just to remind you, if you do wish to ask an audio question, please key *1 on your telephone. Thank you.
Okay, well, we're waiting for that team to come back to us. One of the other points that was often highlighted was the point of the repeat patient. So that patient who's been on an NSAID, they may have been on the naproxen for several months, and they present for a collection of a prescription, and you've had the conversation with them about their safety several times. How do you approach that? Do you not ask them the questions because you know you've spoken to them before? Do you simply go over it regardless? Because it was a real feeling that in some cases there was kind of almost NSAID exhaustion was happening, that the patients would roll their eyes and, oh, not this again. What I would say is that provided things have been done in a conversational way, I think you'll find that actually it still works, and it is very much about every person every time, because that person that you think you've explained everything to may have been told, but how much have they retained, how much will they remember, and there is always that opportunity for the patient who hasn't, simply hasn't remembered that they need to protect their kidneys, just gets that third piece of information for the first time, even although they've been told several times before, and it may just be that one person that's saved the trauma of an AKI and a hospital admission. That might be helpful. Got a question on the screen now about submitting your findings somewhere, and that's again a really good point. Perhaps the best person to answer that question in terms of the quality improvement journey would be Leslie, who's on the call. Leslie, would you like to field that? Someone's just saying, do they submit their findings somewhere?
So you don't need to submit your data to us. I think your data is yours to own and use to inform what you want to do better. So if you find that there's one aspect of the bundle that you're doing less well, perhaps, than some of the other bundle elements, you use that data to inform those discussions within your practice team and say, right, how can we as a group make this better and do that? So the purpose of the data isn't to be a sort of data beast where you submit to us your data. However, if you were wanting some support with your data, I'm more than happy for you to email it to the email address, and we can pick that up and have a conversation with you. Likewise, if you're having some challenges, feel free to get in touch because we're happy to have those conversations. Likewise, if you find that you've got a success story that you would like to share, we'd be delighted to pick that up, because all that's going to do is help others within your community to adopt and move forward with using the bundle. So there's not a requirement for you to submit data to us, but we're open to communication with you and what would best support you. Going back to what you were saying as well, Mark, about the cards, I think what came out from conversations I've had with people that have used the bundle and the cards is that the cards are there as a aide-memoire, if you like, but they're there not to replace a conversation, but actually to empower staff to have that conversation. So there's maybe been some people who have been dispensing the medicines who felt less confident with delivering these messages. They found this a very empowering tool to help them engage in those conversations. And if you had any stories or feedback like that for us, or like Mark had said as well, there was the NSAIDs overload, please get in touch and let us know.
Thanks, Leslie.
Just while we're talking about data as well, I'm just rambling because there are modules available on TURAS as well, and it's sort of quality improvement modules. Kirsty, if we haven't already, can we make sure that the links to the TURAS modules are on the web page under the resources? I think they are, but it's some basic quality improvement modules that will help you with your testing, that will help you go down that sort of improvement journey, and it will help you with your data as well, how to use it and how to interpret it.
Great, thanks, Leslie. Now we've got something in the Q&A box, and I'm frantically trying to get into it, and minimize that one's better. Okay. Yeah. So we have someone asking us about the health board asking them to submit data, so that the pharmacy department can help them with it. Now, the principle of submitting data so that you can get additional support, I think, is fantastic. If you've got a health board who's willing to do that and has the resource to do that, that's great. But as Leslie's highlighted, the data it's data for improvement. It's not data to say, well, actually, you're not doing this properly. yeah, if you've got board support, that's fantastic. Someone asking, how do we measure the effectiveness? I take it that by that what we mean is the clinical outcomes of this, and that's really difficult. That's really challenging, simply because what we're looking at is one small intervention with a massive number of data points in terms of potential outcomes. We have within Healthcare Improvement Scotland been looking at bleed data. It's very complex. It's something that we're still continuing to look at in terms of being able to provide some sort of feedback for everyone. But we're simply not there yet. As I say, the key thing about this bundle is that this is a bundle about communication. So this is about having the good conversations. And one of the ways that you may actually want to measure this is, rather than the clinical outcomes, one of the measures may be in terms of the empowerment of the whole team. Certainly one of the key things that we found from the pilot work was that the marginal gains across the team were very, very significant. So that by giving the staff and the whole team a really simple and structured way of improving, then we opened them up to the idea that they had something to offer. So staff would then come back to us with other improvement ideas and other developments or better ways that they would do in their own job. And we simply empowered them by using this initiative, which was very structured. So you may well find that actually one of the measures of the success and the effectiveness is not just about the clinical outcomes, but they're perhaps what we might class as softer issues, so ways in which the whole team can work better together. We deliberately use the phrase improvement journey. This is very much a journey, and as part of this journey, you've got this one small initiative, but obviously with potentially big consequences for the individual patients.
Yeah. And I think as well, Mark, is looking at the bleeds data, we are working with our health researcher internally to look at evaluation of this piece of work. They're currently exploring with the university how we can look at the evaluation of the community pharmacy piece, but also how we can take forward ourselves the evaluation of the GP dispensing group as well. And we will be in touch with practices over the next sort of 3 to 6 months, maybe with some polls, some questions to ask about your experiences, your stories. Are you using it? Are you not? Has it helped? So, and that's going to help us build in that sort of evaluation of how effective this has been for practice teams to use as well.
That's great. Thanks, Leslie.
There's no questions on the audio. Thank you, Mark.
Okay. And we don't appear to have any more questions in the Q&A. I think on that basis, I would just like to again thank everyone for their participation and for the time today. We've just given you the gift of time today because it's 12 minutes past and we had scheduled till past. So that's great. I'm sure everyone enjoys that. And again, just reiterate that we would love you to get in touch via the website, via the team email address. So as Leslie's already said, not just for the questions you might have, but also for the good ideas and the success stories. We'd really like to hear the success stories because that then generates more enthusiasm and helps. You may well help somebody else. So yeah, please do get in touch.
Okay, thank you very much, everybody.
Okay. Thank you, Leslie.
Thank you, Mark and Leslie. Thank you, everyone. That concludes your conference call for today. You may now disconnect. Thank you for joining and have a very good day.